Have you been feeling a bit off lately? Maybe more tired than usual? Or always reaching for a glass of water? It's so easy to just blame it on getting older. But what if those little changes aren't just another birthday candle on the cake? What if they're your body's early warnings for a silent disease that affects millions of seniors? In this video, we're talking about the early signs of diabetes that are just too important to ignore. So, what is diabetes? Put simply, it's a condition where your body has trouble using sugar from food for energy. This happens when your body doesn't make enough insulin, a key hormone, or can't use it properly. The result is high blood sugar, which can cause serious damage over time. This is a huge deal for older adults. According to the CDC, nearly 1 in 3 people aged 65 or older have diabetes, and what's really shocking is that a huge number of them don't even know it. The signs can be so slow and subtle that they're easy to write off, but catching them early is your best defense against serious problems like heart disease, kidney failure, and vision loss. Knowing what to look for is the first step in taking control of your health. Let's start with what doctors call the 3 Ps, the most well-known signs. First is increased thirst and frequent urination. Do you feel like you can't ever seem to quench your thirst? Or are you getting up all night to use the bathroom? That's not just a quirk of getting older. When you have too much sugar in your blood, your kidneys have to work overtime to flush it out. This process pulls extra water from your body, leaving you dehydrated and constantly thirsty. To get rid of all that sugar, your body makes more urine, which explains all those extra bathroom trips. When this constant thirst and increased urination happen together, it's a classic red flag that you need to talk to your doctor about. The second classic sign is unexplained weight loss. This one can seem strange. Losing a few pounds without trying might sound great, but it can be a serious warning. When your body can't get energy from the food you eat due to insulin issues, it starts burning fat and muscle for fuel instead. This causes you to lose weight, even if you're eating the same amount or more than usual. If you see the number on the scale dropping for no reason, don't just celebrate. See it as a signal that your body's fuel system is out of whack. This next group of symptoms is where diabetes gets sneaky. They're so common in older adults that they often get ignored for months or even years. The third sign is constant fatigue and weakness. Do you feel tired all the time, even after a good night's sleep? Does a trip to the grocery store feel like running a marathon? This isn't just slowing down, it's a hallmark of diabetes. When sugar is stuck in your blood and can't get into your cells for fuel, your body is basically running on empty. This causes a deep, persistent fatigue that rest just can't seem to fix. It can seriously affect your quality of life and even lead to dangerous falls, so it's a critical symptom to watch. The fourth sign is blurred vision. Finding yourself squinting to read or notice things going in and out of focus? Many people just assume it's time for new glasses, but blurry vision can be a direct result of changing blood sugar levels. High blood sugar can pull fluid from the lenses of your eyes, causing them to swell and change shape, which makes it hard to focus. While this can clear up sometimes, if left untreated, it can lead to permanent eye conditions like diabetic retinopathy, a major cause of blindness. The fifth sign is slow healing sores and frequent infections. Have you noticed a small cut or scrape that just won't go away? Or are you getting more bladder infections, skin infections, or gum problems? This is because diabetes affects your whole body. High blood sugar harms your circulation, which means less oxygen and healing nutrients can get to a wound. It also weakens your immune system, making it tougher for your body to fight off germs. Sores on the feet are especially dangerous since they can go unnoticed and cause serious complications. If any of this is starting to sound familiar, do us a favor and like this video so more people can find this crucial health information. And think about subscribing for more videos to help you stay healthy and empowered. Your support helps us reach more people who might be brushing off these important warnings. Now let's get into the signs that are even sneakier, the ones most people would never link to diabetes. Number 6 is tingling, numbness, or pain in your hands and feet. Known as peripheral neuropathy, this can start as a faint pins and needles feeling in your fingers or toes. Over time, high blood sugar damages the nerves, especially the long ones that go to your hands and feet. Since nerve issues are common in older adults, this sign is often blamed on something else, but it's one of the most common long-term complications of diabetes and something you should definitely tell your doctor about. The seventh sign is increased hunger even after you've eaten. Ever finish a big meal and still feel starving? This is called polyphagia. It happens for the same reason you feel tired. Your cells aren't getting the sugar they need for energy. Your body gets confused and sends powerful hunger signals to your brain, thinking you need more food. This creates a frustrating cycle where you eat more, your blood sugar goes even higher, but you still don't feel satisfied. Number 8 is dry mouth and gum problems. Another quiet clue is your oral health. A constantly dry mouth, no matter how much water you drink, is a common symptom. High blood sugar can cut down on saliva, leading to that dry feeling and even cracked lips. It also puts you at a higher risk for gum disease. If your gums are red, swollen, or tender, it could be a sign of high blood sugar. These last signs are things you or a loved one might notice on your skin or in how you're acting. The ninth sign is changes to your skin. Your skin can give you visible clues about what's going on inside. One of the most specific signs is the appearance of dark, velvety patches of skin, especially in the folds of your neck, armpits, or groin. This is a condition called acanthosis nigricans and is a sign of insulin resistance. Just having general dry, itchy skin is also very common. Number 10 is mood changes and irritability. Feeling unusually grumpy, short-tempered, or even sad? The roller coaster of high and low blood sugar can directly mess with your mood. When your brain doesn't get a steady supply of energy, it can throw your emotions out of whack. These mood swings are often blamed on stress or bad sleep, but they can be a direct physical reaction to unstable blood sugar. Finally, number 11 is lightheadedness and balance issues. Feeling dizzy, lightheaded, or unsteady on your feet is a really dangerous symptom for seniors because it seriously increases the risk of falling. This can be caused by dehydration from peeing so much or by episodes of low blood sugar when your body's insulin response is off. Dizziness has a lot of possible causes, but when it shows up with some of these other signs, it should be seen as part of a pattern that needs to be checked out by a doctor. So, we've covered a lot, from the classic signs like being super thirsty and peeing a lot, to the ones that are easy to miss, like feeling tired, blurry vision, and wounds that won't heal. We also talked about the surprising clues like tingling feet, constant hunger, and even changes in your skin and mood. The symptoms of type 2 diabetes usually sneak up on you slowly, and it's just too easy to write them off as a normal part of getting older. But they aren't normal. They are your body telling you something is wrong. If you don't treat it, diabetes can lead to really serious complications like heart attacks, strokes, kidney disease, amputations, and even dementia. Look, the goal here isn't to scare you. It's to give you the information you need to take action. If you've been nodding along and thinking, hey, that sounds like me, please make an appointment with your doctor. A simple blood test can tell you if you have diabetes or prediabetes, which is when your blood sugar is high but not quite in the diabetes range yet. This video is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. If you found this helpful, please share this video with friends, family, and any older adults you know. You might help someone connect the dots and get the care they need before a real problem starts. Thanks for watching, and for taking a big step toward protecting your health.